Welcome to The Explainer. Today, we're diving into something that's absolutely critical for anyone living in or even just thinking about moving to one of the world's top expat spots, Malaysia. We're going to break down how you can navigate its healthcare system and, most importantly, get the right insurance.
Look, Malaysia is amazing. The quality of life, the culture, the cost of living, it's a paradise for so many people. But here's the reality check, the one question you have to ask yourself. What happens if you get sick? That's what we're here to figure out. Okay, first things first. Let's try to find our way through what can seriously feel like a maze, the Malaysian healthcare system. Just understanding the basic layout is the most important first step for any expat. So Malaysia has what's called a two-tiered system. You've got the public system, which is actually high quality and super cheap, but it's really designed for Malaysian citizens. For most expats, that means you're either paying the full unsubsidized price at a public hospital or you're heading to the private sector. And that's where things can get very, very expensive. And when I say expensive, I mean it. Let's just look at the numbers. A specialist consultation in the private system can be more than 6 times the price of the public one. And something as common as an appendectomy? That could set you back up to 30,000 ringgits. Without good insurance, those costs are a massive financial hit, especially since private hospitals are often the first choice for expats who need care quickly. So why is the public system so stretched? Well, part of the story is this number, 4.4%. That's how much of its GDP Malaysia spends on healthcare. Because that's a bit below the average for similar countries, the public system is often under a lot of pressure. That can mean long waits and overcrowding, which is exactly what pushes so many people towards private care to begin with.
And that leads us right into a really common trap for expats. I like to call it the coverage gap. It's that scary place where you think you're covered by your insurance, but you're not really.
So let me just ask you directly, that insurance your employer provides, is it actually enough? For a surprising number of expats, the honest answer is probably no. And just relying on that corporate plan can leave you open to some pretty serious risks. On the surface, these plans can look great, but the devil is always in the details. The annual coverage limits can be shockingly low. You could burn through it with just one serious accident. They often don't cover major things like dental, maternity care, or any chronic conditions. And here's the real kicker for expats. It's not portable. If you lose or change your job, poof, your coverage is gone. And all of this is happening while costs are skyrocketing. As Dr. Saravanan Thambiraja explains, private hospitals can pretty much charge whatever they want, so medical inflation is climbing fast. In an environment like this, having your own robust insurance plan isn't a perk, it's an absolute necessity. Okay, we need to clear up a common and frankly pretty dangerous misconception. Travel insurance is not health insurance. Travel insurance is for emergencies on a trip. It's designed to get you stable and fly you home. International health insurance is what you need for actually living abroad. It covers your regular doctor visits, specialist care, the whole shebang. You can't substitute one for the other. All right, enough of the problems. Let's talk about solutions. It's time to get proactive. In this next section, we are going to build your personal insurance playbook, looking at the best ways to protect yourself and your family while you're in Malaysia. So your biggest choice is going to be between a local Malaysian plan and a big international one. Local plans are definitely easier on the wallet, but they only cover you in Malaysia and usually have a smaller list of hospitals you can go to. International plans cost more, no doubt, but they give you that global coverage. They move with you if you leave Malaysia, and you get a much wider choice of doctors. It really boils down to your lifestyle, your budget, and your peace of mind. Now, just to give you a place to start your own research, here are some of the popular, well-known international providers that lots of expats in Malaysia use. You'll see names like Cigna, AXA, and William Russell pop up a lot because they're known for having comprehensive plans and big networks.
And hey, for our French viewers, there's a really unique option you absolutely need to know about. It's called the CFE. It's basically a way to take the French public health system with you when you move abroad. And its biggest advantage? It automatically covers pre-existing conditions. So what a lot of French expats do is they use the CFE as a base layer and then add a private top-up plan for extra coverage.
Okay, so you know the options out there. But how do you actually pick one? How do you sift through all the brochures and websites? This part, making the right choice, is all about giving you a simple framework to make a smart decision.
Let's just break it down into 5 key things to look at. 1, the actual benefits. Does it cover the things you need, like hospital stays and regular doctor visits? 2, customer support. Can you call someone at 3 a.m. who speaks your language? 3, direct billing. This one is huge. It means the insurance company pays the hospital directly, so you're not stuck with a massive bill to pay out of pocket. 4. Claims. How fast do they pay you back? And 5. Don't be afraid to use an expert broker to help you compare all this stuff. You'll generally find that plans come in 3 flavors. You've got your basic, just-in-case plans that mostly just cover being admitted to the hospital. Then there's mid-tier, which adds outpatient stuff like your regular GP visits. And then you have the premium plans, which are the most comprehensive and often throw in wellness benefits, dental, and vision care. And if you needed one last push to take this seriously, here it is, 12%. That was the medical inflation rate in Malaysia back in 2022. When costs are jumping that fast every single year, having the right amount of coverage is absolutely critical. You don't want to find out you're underinsured when it's too late. Okay, let's zoom out one last time. It's really important to get that you're making this decision inside a system in flux. The whole healthcare landscape in Malaysia is shifting, and that makes your personal choice right now even more important. The Malaysian government is actively looking into creating a new national health insurance scheme. It's still in the early days, but the idea seems to be targeted at the middle and upper income groups, the very people who are currently relying on private healthcare. What it will actually look like in the end, well, that's still up in the air. But it's not simple. This quote from Professor Dr. Sharifa Izad Wan Putek gets right to the heart of the debate. Who's going to pay for it? Who's going to get subsidies? These are the really tough questions that policymakers are trying to figure out, and the answers will shape what healthcare looks like in Malaysia for years to come. And this quote from Dr. Maznad Dalui really highlights the stakes. There's a real concern that if this new plan just ends up being another kind of private insurance, the system could start to look a lot more like the one in the United States with all of its challenges. It just goes to show why securing your own health coverage right now is so critical. So we'll end on this thought. Malaysia is a truly fantastic place to live and work, but you've got to be smart about it. The healthcare system is complicated, the public option isn't really for you, the insurance from your job might not be enough, and costs are rising. So the real question, the one you need to take with you, is this. As this system keeps evolving, how are you going to make sure that you and your family are protected? The power to answer that is in your hands.